Thank you very much. Stefano?
Thank you, Steve. I will focus mainly on Nandini's question about why are we not getting more requests, why countries are not using more the flexibility that exists in the donors, and in this case, particularly in the Global Fund, to support health system strengthening. And this is a question that has also been asked by the technical review panel that has repeatedly commented on the proposal that there were many missed opportunities that they saw in terms of health system strengthening, and much more could be asked for and could be provided by the fund. I think this would be an excellent topic for research as a follow-up to the document, the paper that has just been produced, and I would volunteer for possible explanations for you to research. First, perhaps lack of clarity and uncertainty by the applicants on what they could ask for and what they could not ask for. That we have not been able to communicate this flexibility well enough and make people understand that actually there is a lot more that they could ask for. And in absence of the certainty, then people might be reluctant to apply for resources just for fear of failure. Second is weaknesses in the very systems in country and their capacity to develop sensible proposal, and lack of international technical assistance in this area, where we have strong national HIV, TB, and malaria programs in many countries, and a lot of technical assistance available in the specific disease area. There is much less available within country and internationally in supporting them in the generic health system strengthening area, be it procurement, information system, or the human resources plan, or financing. The third one, which is more specific to the Global Fund, is possibly the fear by the CCM and the applicants that by including these elements in their proposal, if the technical review panel would not like it, the whole proposal would sink and they would also lose their disease component. So there was a reluctance to let these elements in for fear that it would undermine the results of the whole proposal. And this is something we have addressed with the new approach of the Global Fund, where the TRP can actually approve the disease component and reject the health system strengthening cross-cutting bit, or do the opposite. Reject the disease component, but approve the health system strengthening. Hopefully this will remove this fear and allow to come with more ambitious proposal. And finally, I think there is a lack in many countries of essential collaboration between disease programs and the people who are working on the system level, the people who are working on the procurement and distribution, quality of pharmaceuticals, information, health information system. And without this dialogue, with this collaboration, then coming up with solid proposals becomes then very difficult, particularly for the fund that wants to see the results of health system strengthening translated into impact on the diseases. So there are at least 4 and possibly definitely more reasons why countries have not been using this flexibility, and I think studying them and possibly addressing them will be essential to try to increase demand and actually solve these bottlenecks and also increase impact and future impact on the diseases. I will also make just a small comment on the indicators. There's lots of work has been done in harmonizing and develop solid indicators for HIV, for TB, and malaria, not so much on health systems. And we really think we need to work together to develop solid indicator and performance indicator for health system strengthening to allow then performance-based funding mechanism like the Global Fund to invest into that area. And work is ongoing in this area, but we need to really advance rapidly and provide countries with some good guidelines, good toolkits to be able to apply these indicators in their proposal.